My name's Autumn Cooley. I'm going to do auscultation as my technique. Auscultation is done to verify if the patient has normal or adventitious lung sounds. Adventitious lung sounds are heard when there is an obstruction to the airway or there is a restriction to the airway, such as excess mucus secretions or bronchoconstriction. In order to do auscultation, you'll go into the patient's room, introduce yourself, check the charts patient to ensure that you have the correct patient, and then begin auscultation. Miss Williams, how are you doing?
Good, how are you?
I'm good. My name is Autumn Cooley. I'm a respiratory care student, and I'm just going to listen to your breath sounds, okay?
Okay.
Check your armband. Can you verify your date of birth?
5/14/1993.
Okay. You want to make sure you listen to all fields of the lungs, both sides. And then you can ask your patient if they're able to sit up to do so and help them so you can listen to their back. All right, now I'm just going to listen to the back, okay?
Okay.
Okay, Miss Williams, I'm going to help you lay back.
Okay.
And your doctor will be in just a minute, okay?
Okay, thank you.
Thank you.